Congratulations, Mom and Dad, on your new baby. We at Taipei Veterans General Hospital are very pleased to be able to share this special moment with you. In order to get you on track with taking care of your baby, we've made a video that teaches you how to care for your baby and explains common problems that you might encounter at home. We hope after watching this video, you will feel both the warmth and professionalism of our team here at Taipei VGH. Getting to know your baby. First of all, let us learn what is normal for a newborn baby. A normal newborn has a head circumference of around 32 to 34 centimeters, body length around 50 centimeters, and pink skin. Within the first week, his body weight will slowly decrease about 10%. In the first month, his body weight will increase around 1 kilogram and be about twice his birth body weight at 3 months. The normal respiratory rate for a newborn is around 30 to 40 breaths per minute, with a pulse rate of 100 to 160 beats per minute. A normal infant is usually positioned with arms semi-flexed in a W shape and the legs in an O shape. This position does not need to be deliberately corrected, and he does not need to be tightly swaddled, as this might affect his breathing and movement. Behavior of healthy infants. At 1 month, your baby should have fair activity, like being coddled and tracking moving objects with his head and eyes. When your baby is 2 to 4 months old, his head control improves, and he should be able to lift his head and turn it side to side. At 4 to 6 months, he will learn to roll over onto his tummy. At 6 to 8 months, he should be able to play in a sitting position. At 7 to 9 months, he will be able to crawl and start standing, albeit still a little bit wobbly. At 10 to 14 months, you can expect him to take his first steps. These are important milestones in a baby's development. Infant nutrition. The first step in caring for your baby is learning how to feed him. This includes breastfeeding, bottle feeding with breast milk, or infant formula. The nutrition status of an infant has a great effect on their growth and development, and breast milk is the ideal food choice for infants as it satisfies all nutritional requirements until the baby is 4 to 6 months old. The advantages of breast milk compared to infant formula for the baby include breast milk being easier to digest, providing antibodies for improved immune function, helping neurological development, and building a foundation of trust between mother and baby. For the mother, breastfeeding stimulates uterine contractions, decreases postpartum hemorrhage, and helps with post-pregnancy weight loss. Breastfeeding positions. Breastfeeding may be awkward at first, so experiment with positions that you find comfortable. Common positions are the cradle hold, cross cradle hold, football hold, and side-lying hold. If you are sitting in a chair, an armchair provides adequate back and arm support, and an L-shaped pillow provides extra comfort. If choosing the lateral lie position, hold the baby in front of your chest, have pillows to support the baby's back. Then face your baby towards your breast, tummy to tummy, placing his ear, shoulder, and hip in alignment and supporting him with one hand. Once your baby latches on, you can make a C with your free hand and press gently on your breast to help your baby suckle more easily. Timing of breastfeeding. Usually, the baby is fed according to his needs, which is usually around 8 to 12 times a day. During each feed, you should let him suckle at least one breast. And if he is still hungry, then let him suckle the other breast. You should switch the breast you let the baby suckle on first each time, as this allows adequate stimulation of both breasts so that you can produce more milk. Some babies eat faster than others, requiring 5 to 20 minutes, while others may take up to over half an hour, so mothers should be patient. Additionally, mothers should check if babies are latching on properly. How to check if the baby is latching on correctly. The correct way to coax your baby into latching on is by first using your nipple to gently touch your baby's mouth. When he opens his mouth wide, place your nipple inside, making sure that your nipple is above his tongue. Check that his bottom and top lips are flanged out, like fish lips, especially the bottom lip, as it should cover the lower part of the areola as much as possible. When your baby is suckling, there will be a rhythmic pattern, slow and deep, followed by an audible swallow. If he makes slurping noises, check his latching position. After nursing, he should be relaxed and content. If your baby cannot latch on properly at first, take a rest and then try again until he manages to take a big mouthful of your nipple. If your baby frequently falls asleep while breastfeeding, you can gently rub his ear or back, or remove an article of clothing to wake him up. If you have any questions regarding breastfeeding, feel free to contact us at our 24-hour hotline 02-5568-1050. If you choose to express your milk by hand or breast pump, remember to wash your hands first, clean your nipple with water, and use sterilized containers. Follow the rule of 3s when storing your milk: 3 hours at room temperature, 3 days in the fridge, and 3 months in the freezer. If you wish to store breast milk that is collected at different times in the same container, it is best to collect them separately in the refrigerator first and pour them together when they are at the same temperature. Heat the milk using a water bath to below 60 degrees Celsius. If the warmed milk is not finished within 1 hour, throw it out. If frozen milk is left to thaw in the refrigerator for over 24 hours, throw it out as well. Do not refreeze. If you are using infant formula, make sure to choose those manufactured for children under 1 year of age. First, wash your hands with soap and water, and then gather the materials you will need, including water heated to 70 degrees Celsius, sterilized bottles, and infant formula. Add water to the sterilized bottle, and then add infant formula. Note that different brands require adding different amounts of formula, so check the label carefully. Close the lid and mix thoroughly by gently shaking or swirling the bottle. The final amount of formula will be slightly more than the amount of water that was added. Before feeding, check the temperature of the formula or milk by dripping a little onto the side of your wrist. It should feel lukewarm. You can also prepare a small bib for cleanliness. When feeding, make sure to raise your baby's head 30 to 45 degrees to prevent choking. The milk should fill the whole bottle nipple, as this decreases the amount of air ingested and thus decreases the likelihood of a gassy baby. If your baby is often gassy, fussy, or has reflux, you can pause during a meal to burp him and then continue feeding. If your baby is a quick feeder and forgets to breathe while eating, you should pause to pace him and consider burping him as well. To burp your baby, first put a cloth over your shoulder to protect your clothes from spit up. Hold your baby against your chest with his chin resting on your shoulder. Gently rub or pat his back with an upward sweeping motion. Make sure he is facing sideways in order to not affect his breathing. You can also position him on your lap, using the palm of your hand to support his chest and fingers to support his chin and jaw. Lean him slightly forward and burp him with the other hand. Is my baby drinking enough milk? To determine whether or not a baby is feeding enough, usually we look at his urine amount and color. After 3 days, he should urinate 6 to 8 times per day, and the color should be clear to pale yellow. This means that he is getting enough milk. Additionally, you should be able to hear your baby's swallowing sounds while you are feeding him, and when he releases your nipple, it usually means that he is satisfied. If he is receiving adequate nutrition, he will return to his birth body weight at around 2 to 3 weeks. Each week, he will gain around 100 to 200 grams and be 1 kilogram heavier at 1 month than his birth body weight. Bottle-fed babies usually drink on average about 150 milliliters plus or minus 30 milliliters of milk per kilogram per day. However, each baby is unique and variations are acceptable as long as their growth and development are on track and their activity is fair. As for nutritional supplements, the Taiwan Pediatric Association suggested in 2015 that for exclusive breast milk infants and for those who intake less than 1,000 milliliters of infant formula per day, 400 IUs of vitamin D should be supplemented each day, and iron supplements should be started at 4 months old. Next, we will discuss how to bathe your baby. First, you should gather all the items you need for bathing, including a washing tub, small towel, water temperature probe, large towel, and clean clothes. Other items you should have on hand include diapers, baby soap, 95% alcohol, cotton swabs, and drinking water. What is the correct order to wash a baby? Fill the tub with water at 37 to 40 degrees Celsius, adding cold water first, then hot water. You can use a thermometer or the inside of your wrist to test the water temperature. If it is acceptable, then place your baby in the water. The bathroom ambient temperature should be kept at 25 to 28 degrees Celsius. Start from the face and head, and then wash his front and back. Immediately dry him off with a towel after bathing. By following these steps, bathing can be a very soothing experience. After unclothing your baby, wrap him up to prevent heat loss. Support his head with one hand. Rinse the towel in drinking water. Wrap the towel around your finger and gently wipe the baby's mouth, tongue, and lips. And gently wipe away the dried mucus that has collected in the corners of your baby's eyes. Changing corners of the washcloth each time to prevent cross-contamination. Start from the inner side of the eye, moving to the outside. After the eyes are clean, continue with the ears and nose. Add a small amount of mild bath soap and wash the hair. You can gently fold the baby's ears forward with your hand to prevent water from entering the ears. To wash his body, place him into the wash tub, supporting him by his neck and arm. Wash from top to bottom with extra attention at the neck, axilla, and inguinal folds. Then you can turn over the baby and keep them facing down. We need to support their neck and trunk with one hand to keep them stable when washing their back. After bathing, wrap your baby in a towel and pat the baby dry. Then you can diaper and dress the baby. Umbilical cord care. Next, we will demonstrate how to care for your baby's umbilical cord stump. Use a cotton swab and dip it into 95% alcohol. Clean around the stump in a circular motion, making sure to clean thoroughly in between the folds. After the stump falls off, if there is a minimal amount of blood or discharge, you should continue to clean the belly button daily until the wound is completely dry. When to visit the doctor regarding your baby's umbilical cord. Parents should closely monitor the baby's umbilical cord stump each day. If there is abnormal discharge, hematoma, or foul-smelling drainage, it is likely that his umbilical stump is infected. If you notice any of the above, you should bring him to our clinic for examination. Also, if you notice a bit of lumpy flesh remaining, this is an umbilical granuloma and can be treated in the clinic. The stump will dry and fall off at around 7 to 14 days. You can clean the stump after bathing your baby. If the stump is frequently wet at the base, you should clean it more often than once a day. If there is redness of the skin around the base of the cord, foul odor, or discharge, see a doctor for professional evaluation. Neonatal jaundice. Neonatal jaundice can distress many new parents, as the baby's eyes and skin looks yellowish, but this is actually very common in newborns. What is neonatal jaundice? Jaundice usually manifests at 2 to 3 days after birth, reaches a peak at 3 to 5 days after birth, and resolves spontaneously at about 1 week after birth. However, infants that are fed exclusively with breast milk may have jaundice for a longer period. If the level of jaundice is in acceptable and safe range, this is called physiologic jaundice and does not require any treatment, so you don't need to worry. To correctly evaluate your baby's jaundice, you need to find a room with adequate lighting. Look for yellowish sclera, the white part of the eyes, and yellowish skin of the head, trunk, and extremities. If only the eyes are yellow, then the jaundice is mild. If the trunk and extremities are yellow, then you should be more careful and consider consulting a doctor for evaluation. Management of neonatal jaundice. If you notice severe jaundice or jaundice that persists for over 2 weeks, immediately visit the hospital for evaluation. Also, if your baby passes clay-colored or pale yellow stools, also bring him in for a checkup, as this indicates he may have a liver condition. Don't forget to bring in the troubling diaper or take a photo of it for the doctor to see, as this helps with making a correct diagnosis. Common problems in newborn babies. Next, we will discuss common problems encountered in newborns, including spitting up, burping, excessive nighttime crying, infantile colic, diarrhea, fever, noisy breathing, and skin rashes. It is common for infants to have spitting up. Please notice the frequency and volume of spitting up. Parents just need to observe if the frequency is low and if your infant has normal weight gain. To relieve spitting up and vomiting, time your feeding so that your baby drinks at a slower pace and make sure to burp him before placing him in bed. It is safer to lie him down on his right side with his head angled at 30 to 40 degrees, as this decreases the likelihood of choking if he vomits. As your baby grows, spitting up will gradually improve over time. Note, if he vomits a large amount of milk, he may choke on it and even asphyxiate, so if you notice him vomiting, immediately turn him over onto his side and pat him on the back. Do not keep him lying flat on his back. If vomiting occurs frequently, take him to the hospital for examination. Newborns often experience bouts of hiccuping after feeding, and this is a natural phenomenon. If hiccuping is severe and causes your baby to vomit, you can give him a pacifier. Why does my baby cry excessively at night? Your baby will often cry for hours at a time at night, and this causes a big headache for new parents, as the baby is hard to soothe despite holding and rocking. When daylight approaches, then he goes to sleep. This inconsolable crying may be due to physiological needs or bodily discomfort. Most often when babies cry at night, it is not because they are uncomfortable or upset, but rather because they have not established a circadian rhythm. When they are still in their mother's belly, there is no difference between night and day, and so after birth, while the adult sleeps, the baby may be wide awake and cry for milk or coddling. If your baby cries in the middle of the night, first check to see if they're hungry or have a wet diaper. If the baby's physiological demands are met, then try holding them and patting them gently. When your baby is a bit older, night cries usually decrease in frequency. Infantile colic. Infantile colic is another common scenario, characterized by continued crying for 3 hours, 3 times weekly, lasting more than 3 weeks. Episodes of crying are often between dawn and midnight. No obvious pathogenesis has been discovered in current medicine, but it's possibly related to abdominal distension or milk protein allergy. After a pediatrician assessment to rule out other diseases, probiotics or hydrolyzed formula can be discussed with your pediatrician. Additionally, positioning a baby prone on your lap or holding the baby and gently patting the baby's back may relieve the discomfort. Observing the baby during drinking, you may notice incompatible feeder, which are too small, too large, or too flat, which leads to swallowing too much air. A bloated tummy should find relief after the above management. After the baby matures, so does the baby's swallowing and digestive function, thereby relief of the associated symptoms. Most night crying is not associated with major problems. Therefore, parents shouldn't be overly anxious. Diarrhea. Diarrhea is another common intestinal problem. Usually symptoms include watery form, greenish color, foul odor, sometimes tinged with blood or mucus. Why does my baby have diarrhea? How do I prevent diarrhea? The main causes of diarrhea include viral infection, bacterial infection, milk protein allergy, etc. The most important preventative measure is sanitation. Therefore, milk bottles and pacifiers should be properly disinfected. And adults should always wash their hands when handling milk bottles. Breastfeeding is best for babies, since the immunoglobulins contained in breast milk enhance the baby's immunity. It is important for mothers to wash their hands and clean the breast prior to breastfeeding. The 3-3-3 rule should be kept in mind when it comes to breast milk storage to keep breast milk fresh. Use disinfected bottles and breast milk storage containers. Another possible reason for watery or blood-tinged diarrhea is a milk protein allergy. In a baby fed with formula, partially hydrolyzed formula may be recommended by your pediatrician. In a breastfed baby, besides inspecting the process of breastfeeding, storage, or reheating, mothers should avoid certain hyperallergenic foods such as kiwis, milk, shellfish, nuts, etc. In case of severe diarrhea, mucosa and intestinal villi may be damaged, leading to transient lactose intolerance. The baby may have a bloated stomach or diarrhea after milk feeding. Diluting the formula or milk or adjusting to a lactose-free formula for the time being may be considered. Is teething associated with diarrhea? Teething is itchy for a baby, which explains their tendency to place objects in their mouth, thus swallowing unintended dirt or bacteria, leading to diarrhea or even fever. Medical attention should be sought for thorough assessment. Fever. Fever should be managed attentively. A baby's body temperature is often affected by room temperature, clothes coverage, showering, exercise, or physiologic fluctuations. The definition of fever is body temperature more than 38 degrees Celsius. Fever is a normal immune process against external pathogens, such as bacteria and viruses. If a baby's body temperature is elevated without reaching fever and presents with fair activity, taking some clothes off or attentive observation may be considered. However, if activity and appetite are reduced or body temperature reaches above 38 degrees Celsius, medical attention should be sought for the underlying cause of fever as well as appropriate management. Noisy breathing. In our experience, 9 in 10 parents will mention a runny nose, gurgling noise, or noisy breathing in 1 to 2-month-old infants, especially during feeding. Noisy breathing is a very common problem. Physiological nasopharyngeal secretions become excessive for a slightly narrower nasopharyngeal tract in a neonate, therefore leading to noisy sounds when air flows through the narrowed airway. Most of the noises are considered normal, but when feeding or sleeping is compromised, medication may be considered. Cleaning the visible nostril secretions away with thin cotton swabs can be attempted. However, suctioning is not advised for deeper secretions due to concerns about mucosal damage. Another tip is to try covering the baby's nose and mouth with a warm towel, which may transiently relieve the obstruction. If the following symptoms develop: frequent choking, distressed breathing, feeding intolerance, or frequent frightening during sleep, early assessment by a pediatrician is recommended. Skin problems. Baby skin should be cared for with gentle tenderness. Any stimulants, including saliva, breast milk, sweat, or oil, will cause a reddish rash, including erythema toxicum, sebaceous dermatitis, or diaper rash. Erythema toxicum usually develops within 2 weeks after birth, appearing over a baby's face, front chest, back, or proximal limbs. The spots are variable in number and macular in character, around 1 to 2 centimeters, sometimes with a small central protruding vesicle, which is more obvious after crying or bathing. The rash usually goes away in around 2 weeks. Besides keeping the baby aerated, cool, and dry, no treatment is required. Sebaceous dermatitis is another common baby skin problem, often involving the scalp, face, neck, axillary folds, and inguinal areas. Typical presentation is characterized by thin crusts over the eyebrows or behind the ears. Gently washing with warm water for adequate cleaning is usually appropriate. No scraping or topical cream is required. It usually goes away without treatment. If cracking or oiliness is severe, cleaning with baby shampoo for a few days will usually reduce severity. If obvious, erythematous swelling, exudates, or skin breaks are present, medical attention should be sought. A red butt is diaper rash. Aside from during baths, a baby is constantly wearing a diaper. Along with frequent mushy stool passage, the covered areas present with irritated erythema and rash, which may be infected with bacteria or fungus if not appropriately managed. The baby may present with irritability, poor sleeping, and reduced appetite. Keeping a baby's butt clean, washing instead of wiping, frequently changing a baby's diaper, occasionally opening the diaper to keep the baby's butt dry, or using topical cream for local protection are some useful strategies to address diaper rash. If the rash persists, medical attention should be sought for evaluation of possible fungal infection. How to care for baby skin. The rule of thumb is first, to clean, and second, to keep dry and aerated. Due to immaturely developed sebaceous glands, imbalanced secretion often occurs. You may notice some parts are too oily and some parts are too dry. Besides cleaning oily-prone areas such as the eyelashes, forehead, scalp, post-auricular area, or skin folds, cleaning for saliva, sweat, or breast milk is also important. For dry areas such as the cheeks, it is best not to overly clean them and sometimes use baby lotion for adequate moisturization. Additionally, due to immature temperature control, especially cooling, a baby should be dressed accordingly. In summer, a baby should be lightly dressed. In winter or in an air-conditioned room, keeping warm and dressing a layer more than adults is advised. If the above tips are followed, it is likely to reduce rash eruption. However, because a neonate's skin is sensitive, some rash will develop despite meticulous care. Therefore, parents shouldn't be overly concerned if the rash is not severe. Newborn screening. Besides physical examination, pediatricians will arrange newborn screening for your baby. Blood spot screening for metabolic diseases and rare diseases, hearing screening, and critical congenital heart disease screening are all designed for one purpose: early diagnosis and early treatment. The purpose of screening for rare diseases. In the era when a rare diseases screening program had not yet been established, some children presented with illnesses which could not be properly diagnosed. Early diagnosis is now possible with the Rare Diseases Screening Program, thereby providing early understanding. Due to the hereditary nature of some rare diseases, early screening provides thorough hereditary counseling. Though some rare diseases cannot be treated, with the advancement of medicine and medical technologies, the future is promising. Newborn screening began in the year 1989, and things that can be screened for have increased since then. Currently, most of the government-funded screening items for rare diseases have the following characteristics. Firstly, some metabolic disorders are not that rare. For example, the incidence of congenital hypothyroidism is 1 in 4,000. Secondly, some symptoms do not appear early. Thirdly, and most importantly, if screened early, timely diagnosis and treatment can save a life from disability or death. The pathogenesis of more and more rare diseases have been discovered over the years, and new medication and treatment methods are made available. Since the incidence of some rare diseases is very low, some without effective treatment, mass screening is not yet funded by the government. Our hospital provides self-paid screening items. Importance of hearing screening. According to research results, every 1 to 2 out of 1,000 neonates are diagnosed with moderate to severe congenital bilateral hearing impairment. Congenital hearing defects can be detected early by screening programs. Intervention can be initiated before 6 months of life, with promising language, cognitive, and communication skill development in the future. Screening for critical congenital heart disease. Congenital heart disease is one of the most prevalent clinical congenital abnormalities. According to regional data, approximately 13 in 1,000 neonates are diagnosed with congenital heart disease. 1 to 2 of these patients are diagnosed with critical congenital heart disease, often requiring cardiothoracic operations or cardiac catheterization within 1 year of birth. Most are required within 1 month of birth. Most of these babies present with cyanosis symptoms. Some lack early symptoms, leading to heart failure. Without early intervention or diagnosis, poor outcomes including neurologic or cardiac sequelae are dire consequences. Early screening of critical congenital heart disease provides early diagnosis and timely intervention, which effectively reduces mortality and associated sequelae. Vaccination. Vaccination is the first-line defense for babies against diseases. Vaccination is a vital preventative medical measure to improve a baby's immunity, prevent diseases, and prevent the spreading of contagious diseases, which can cause death or disability. The Baby Handbook lists scheduled vaccinations. Aside from routine vaccination, Self-paid vaccines such as rotavirus vaccine or seasonal vaccines, including influenza vaccine, are important to ensure the healthy well-being of children. Baby massage. The room temperature recommended for a baby massage is around 26 to 28 degrees Celsius, with adequate lighting to observe the baby's needs. Prepare a soft and comfy corner, as well as some toys. Choose natural massage oils derived from plants, such as sweet almonds or grapeseed oil, in order to reduce friction and enhance skin radiance. Some baby oils contain too much mineral oil, and most baby lotions contain insufficient oil. Perfumed essential oils are considered irritants to a baby's skin. Before applying the massage oil on the baby, test the oil on the back of the baby's hand for 30 minutes. The baby could be allergic to the oil if a rash develops, which should go away in around 1 to 2 hours. Different areas can be massaged in different ways. 2 ways to massage the abdominal area are provided. The first is use the I Love You tummy rub. Write the letters ILU on the tummy, which aids in peristalsis of the colon and rectum and helps stool or gas passage. The second is the water wheel method. With a forward and downward stroke similar to paddling, repeat several times with the belly button at the center in a clockwise fashion. When massaging a baby's back, the spine should be centered, gentle sidewards rubbing used. Massage strength should be downwards, moving gently and slowly. Stay attentive to the baby's expressions at all times. In case of crying or resistance, stop immediately. Monitor the baby's condition to determine whether the massage can be continued. Parent-child joint reading. Reading should be initiated as early as possible. The foundation, habit, and interest in reading can be cultivated as early as reading to a newborn baby. The development of various senses, including hearing, visual, and tactile functions, are stimulated by listening to the voice of the storyteller, which further inspires brain development and creativity. Reading and love for reading begins by adults setting the role. Several ways to spark reading intimacy include storytelling on the laps of adults or engaging children in play. Pleasurable memories of reading may influence a child's lifelong reading habit. Choosing different reading materials at different ages will satisfy children of all age groups. Instead of reading word by word, functional books, such as waterproof books for infant use during baths, or cloth books will keep curious babies entertained. Exchanging reading material with friends, taking children to the library, or using resources online are ways to broaden your child's perspective. We hope you enjoy becoming happy readers with your child. The welcoming of life is filled with joy and happiness. All staff members at Taipei Veterans General Hospital dedicate our blessings to your family. We hope to address and answer some of your questions regarding caring and nursing for your newborn baby. In case you encounter any problems relative to daily nursing or medical issues, all staff members of Taipei Veterans General Hospital are more than glad to provide counseling as well as medical services so that your baby may be nurtured and embark on the journey of life. Thank you.